right, and then I'm sorry, y'all. Forgot to do the script. Almost ready. And there we go.
Well, good afternoon and welcome to June meeting of the Board of Health. Hope everybody had a good, like a couple months off, and it started getting a little bit better weather, and then it turned rain. And we had some of that New Testament rain for a little while there, but welcome, and hope everybody's in good health. So our very first item is to welcome our new member of the public citizen slot that we've been avoid for a little while, and that is Miss Crystal Yates. What I know so far about you is there's a nice restaurant that we can maybe we can go back to having a meal. No, I'm kidding. We did move this, and that was the only sore spot, I guess, for some people. But it sure did save a whole lot of work, didn't it? All the lunches and stuff to get lunches. But anyway, thank you very much. Is anything else you wanted to bring up about?
I thought we would do the oath of office and then we can do some introductions and then we'll
Okay.
get Miss Yates to just tell us a little bit about herself and then we'll all introduce ourselves to her after we do that. So
Sounds good. I guess then that's okay. Then we'll do the oath of office.
Stay seated. Oh, you would put your left hand on the Bible and raise your right. I think you'd like it. I state your name.
Crystal Yates,
Do solemnly swear
do solemnly swear
that I will support and maintain
that I will support and maintain
the Constitution and laws
the Constitution
of the United States
of the United States
and the Constitution and laws
and the Constitution and laws
of North Carolina,
of North Carolina,
not inconsistent therewith,
not inconsistent therewith,
and that I will faithfully discharge
and I will faithfully
the
discharge
duties of my office
the duties of my office
as Board of Health member.
as Board of Health member.
So help me God.
So help me God.
I state your name.
I, Crystal Yates,
Do swear
do swear
that I will well and truly
that I will well and truly
execute the duties
execute the duties
of the office of Board of Health member
as the office of Board and Health member
according to the best of my skill and ability,
according to the best of my skill and ability,
according to law.
according to law.
So help me God.
So help me God.
Congratulations.
Thank you.
Yes, please.
Or it was all being recorded. Over here, Lillian. Well, I'll go ahead and start a quick around the horn if we can, introduction. That way we can get the least important person out of the way, and we'll end up with the most important over here with Lillian. So, but I'm Terry Ellington. I am native of now about 22 years living in Davidson County up in the north area. Sometimes when I have to go all the way down to Thomasville, a place like that, I feel like I need to schedule a flight being all the way up there. But awesome county. Loved every last 22 years. Practice up in Winston-Salem though. I'm an optometrist up there, and I've been the chairman now for a couple of years, and I try each year, and they won't kick me out. So welcome though. It's good to see you.
Thank you.
Hello, I'm Calvin Ohm. Good to meet you. My wife worked here for 30 years almost, so I have some history that way at least. I'm a retired pharmacist. This is my second year. Lifetime resident of Davidson County, and I would tell you how long, but I would tell you my age. So anyway.
Hey, I'm Trip Kester. I've been a resident of the county for 30 years, deputy sheriff, and your most recently elected county commissioner. It's great to have you on board.
Thank you.
I'm Justin Iphone. I'm from the metropolis of Reedy Creek. I'm in real estate.
Hey, Chris, Jason Gibson, you know me, so I won't bore you.
Good to see you as always.
I'm Adam Jones. I'm the county attorney.
Brian Hargrave, I'm one of the assistant county attorneys.
Hi, Crystal.
Hi.
It's Stacy.
Yeah, big and legendary.
I'm Michelle Allen, WIC director. I am Corinne Bates, the business officer.
I'm Jana Walker. I'm the Director of Health Promotions.
Mary Lou Collett, nursing director.
Randy Swicegood, Environmental Health Director, On-Site Water Protection.
Mark Cameron, I'm the veterinarian on Barton veterinarian in Davidson County, about 33 years.
I'm Christian Brandenberry. I'm the dentist on the board. My practice is in Thomasville. I've been there for about 20 years now.
Hi, I'm Deidre Delpatrick and I'm the nurse member on the board.
I'm Lillian Coates. I'm health director, and Belinda and I got to meet with Crystal, so we got to share and orient and do all that stuff. So
I forgot about Belinda, but you want to say anything else? I forgot about it. He's over there so quiet. Well, again, welcome. We're glad you're on here. That way, kind of have a full complement. All right. Well, item number 2 is the agenda. I think everyone got it. Prior to the meeting, has anyone everyone had a chance to look at it? Okay. Anyone? Oh, okay.
yeah, mine. Here we go.
You probably got it memorized. no?
Okay, all right. Any discussion about the agenda for today? Then I'll just need a motion to accept it. Second,
Second.
all in favor?
Aye.
Any opposed? All right, thank you very much. That carries. All right, and item number 3 is our public comment. Did we have any?
Mr. Chairman, no one registered for public comment.
All right, thank you very much. And number 4 is our consent agenda in the packet. Was there any discussion about those items? All right, not hearing any. Then is there a motion to accept it? Right, Mr. Odom, and a second?
Second.
Second. All in favor?
Aye.
And any report? I mean, thank you. All right, and always a carve out time. If there's anything, Commissioner, you have anything from the Board of Commissioners to pass along or vice versa?
No, right offhand, I don't. Short and sweet.
Thank you very much. And then now for the person who will have plenty of things for us to do, and
Yes.
that's our health director's report.
Alrighty, thank you, Mr. Chairman. As usual, we like to start off with the state of the agency. Right now, we are recruiting actively for 3 positions. 2 are WIC nutritionists. We'd like to thank Michelle for reaching out to UNCG to try to snag some recent graduates. So far, that's not worked out, but we are trying our best to sort of expand how we're getting folks in the door. And then we are looking for another school nurse, which is the summertime. So maybe somebody will think they want their summer off next summer and want to come and join us. But we do have a couple of applications and Kristen is working through those. We're still holding on a few. And again, there's some reasons for that. The WIC position for the peer support, just for the end of the year with the budget, and we're going to wait to see what it looks like next year. And as we've talked about in our last meeting, we are holding on this office support nurse provider until we feel like we have the need with the clients in the clinic before we fill those positions. And that's sort of like a pipeline. They see us in office support, they see a nurse, and then potentially a provider. So until we've got a few more client needs, we're going to continue to hold on that. We are closing off on the finalization of the budget with the county. Corinne and I are just holding our breath to see what changes there might be when the commissioners approve that budget. We had a very successful first rabies clinic. Want to say our staff that participated did a really good job. They were without the typical leader. He had something to do that day, so we had other folks step in and do that, and so they did a really great job. And we did 216, Randy.
I told you the number.
I know.
Pretty close. It was
It's somewhere, right?
low 200s.
Yes. And we will have another one of those. And that one was here at the health department. And there were no incidents to report. So it went really smoothly. This year, the North Carolina Public Health Association hosted a legislation day, which essentially meant they scheduled appointments for anyone who wanted to within the Health Directors Association with your local representatives in Raleigh. And then you go there and they give you a packet of like public health stuff. So I got to meet with Senator Jarvis, with Representative Watford, and then Representative Potts had a conflict, but I got to talk with his aide, Caroline, for the longest time and catch up. And so it was really great to actually see where they work in Raleigh and talk with them a little bit about public health. Representative Potts has been incredibly active this year with public health concerns and needs. And so catching up with Caroline was just to say thank you. And then Senator Jarvis is always someone that we can count on for any help. So it was great to chat with him. And we weren't able to get an appointment with Representative Watford, but he saw me in the hall and he was like, "Oh, Lillian, come on in. I got about 3 minutes." And he gave me all 3 of those minutes, and it was just really nice. So it was great to just catch up with him, and I was able to drop off the public health information that they had for us. But a neat day. If y'all have never been up there, I would just say it's something you should do because it is a experience to watch all different types of people. There was Boy Scouts of America. There was several nonprofit agencies, everybody standing around, they're dressed to the nines, and they're waiting to get their time with their representatives. And it was just a really neat day, and to see sort of how our legislation works. It was really nice. And it was really I really appreciated the NCPHA handhold because they sort of navigated and helped us because there's 2 buildings and you had to figure out where you were going. And it was a really neat day. So I was really glad that I got to participate in that. Speaking of legislation, here's a timeline on where we are with the legislative session. I got this from Patrick Brown with NCPHA, and the red star that you see on there was our last meeting, which was April 1st. And the reason I put that on there, and we'll talk about it in our next item of old business with the THC letter, but we met on April 1st, and then the House filing deadline was so close, and we'd already missed the Senate bill filing deadline. So with the THC letter, we had some date complications that we'll discuss in a moment, but this is kind of where they are. The House budget has been released and we're just waiting to hear more information about that. These are the items that I reported to y'all last meeting. And so I didn't even have to do anything to this slide except add the red writing. So these are the changes that we've seen since April. The House Bill 197, Representative Potts was a sponsor for that. That was recurring communicable disease funds to come to local public health departments. It unfortunately was not included in the budget. Representative Potts just let us know, it's a tight budget year. And so we were not able to see that in the budget. These others, we've seen some that didn't make it and then some did. So we will continue to hold out to see where these things go. As it stands right now, nothing really earth shattering to report to y'all, but I did want to just update you on these things. Today, Michelle did our inaugural first day soft opening of Baby Cafe. And Mary Lou was telling us this morning in our staff meeting about how she had seen it on the news and we're advertising it. And so today, Michelle, you went.
Yes.
Can you tell us a little bit about it?
It was a really great first day. It was our soft opening, and we had 4 participants that came, so that was really amazing. I would have been happy with just 1, but we had 4, so that was pretty incredible. I had 1 nutritionist with me that is also trained in breastfeeding. So and then we had the Baby Cafe team as well. So we were really excited, and we look forward to expanding our WIC outreach.
We really do want to see more WIC participants choose breastfeeding. There's a whole health component. There's a cost savings component with not using formula. And so being somewhere like the Baby Cafe is a great place to just, some people, especially first-time moms that have never breastfed, normalizing breastfeeding can be challenging. And so doing something like this is a great way for us to sort of increase and improve those rates that we see in Davidson County. We are sad to say our school nurses are leaving for the summer. They are not sad. They are all very excited. They were having a staff meeting in here the other day and I poked my head in and you could just feel the energy. They are so ready for this summer break and we're really happy for them and appreciate all that they do. But it does get a little quiet around here. We do still have 3 folks that'll be here over the summer because as y'all know, summer school continues and there's also a lot of work to do to prepare for next school year. Stacy's done a great job. We're at 100% compliance with our food and lodging inspections. Our business office is working hard on our WIC audit with Michelle, which is a little bit complicated right now because the state system Crossroads is not behaving. And we're having some challenges getting in there, but this audit thing, Commissioner Kester, I don't know how much you know about the audit that the county goes through, but it is like in depth and they want to know the page number, paragraph, the sentence that these things are in. And Corinne and Michelle are having to provide documentation ×3 for all of the stuff that they're looking for. So it's been a huge time resource allocation to this and emails back and forth and uploading things. So huge shout out to y'all. Thank you so much for doing that. But this is just part of the county audit and they
Right.
pick WIC to participate. So lucky us. And they want all sorts of things. So we've been very busy with that. But so far it's going well. Community health needs assessment, Jana worked really hard on getting that out. We had 839 community responses. A lot of white women who are like my age apparently really like to do surveys because that was the largest demographic. So like I am your person that does these things, but we did get 839. So we were appreciative of that. We will be diving into that data. We will be releasing reports and we'll be using that data at the health department to sort of guide our next steps and what's needed in Davidson County. And that includes the program reports, sir.
Thank you. Any questions about that for Lillian before we move on?
Yeah, I mean, Lillian, going back to the 100% on food and lodging, that's a big deal, correct? Because we were not 100% a couple years ago, right? Nowhere close, right? It was bad. Is that a fair
Very.
assessment? Okay. And I just, for people that weren't here or whatnot, like that was an issue in 22, 23, it seems like. So congrats on whoever's working really hard on that. I know who it is.
She's worked really hard and this year too, she worked really hard in preparing staff to be authorized in pools. So we were able to really meet the needs of our community a lot better with more than one human that could go out. Y'all know how large Davidson County is. If Laurel Oaks wanted their permit on the same day Denton did, I mean, that's a haul. And so with having more folks authorized, all but one were authorized this year, is that correct? And we're getting the other person done. It was just a time thing. But we were able to be more efficient with our time and resources, and then it wasn't so stressful. And we're just really glad that we could be where we are now. So we're crossing fingers and toes that we stay fully staffed for some time because training, as y'all know, takes some time and energy. But we're really, really thankful for that. So yes. Thank you for bringing that up. That was a big deal.
And thank you for that report. So item 7, right? Yeah, item 7 is the old business we have. A lot of us heard about this last meeting. Our county to our east, Randolph County, identified the true that it was.
I think it was a personal plight and an individual really wanted to see something changed.
Yeah. If you got just a second for the benefit of like Crystal, and then could you give us a quick little synopsis of why we come to this decision of doing a letter ourselves?
The Randolph County Board of Health identified what they saw as challenges with THC products that were available and sort of marketed at youth. And so they had found some packages and we showed photos. It looks like a regular old Skittles package, but it's actually THC laced Skittles. And so they wrote a letter and we're asking other boards of health to sort of jump on board with them to write letters to request legislators really dive in deep on what they would allow in North Carolina as it related to THC products. At that time, we became aware of the ask just prior to our meeting and we had not been able to really do a lot of research. Anna and I did a public health field trip, and let me tell you, that was an interesting day.
Was it just one day, Lillian?
It was one day.
You had to recheck.
Yes. And all we needed, we didn't sample any products, but we went to 3 different places and they were very different. The first place was a gas station and they had a food service, they had typical gas. They also had all sorts of things that you would like to buy. Like if you need a lighthouse, they got it, or brass knuckles. That's your place. White t-shirts too, they had those. I think they had some knives. It was an interesting spot. They had things at the register that were liquid. They had what looked to be gummies, but we didn't see anything like candies that we had been told that Randolph County was really concerned about. we didn't ask any questions there. We just sort of looked around. I think we bought a soda or something. I mean, we were like incognito. We didn't have our badges. We were doing our thing. The next story.
Are you saying you blended in with the client base?
Was the Shell station in Welton. We didn't look out of place.
We looked out of place there. The next place we maybe looked out of place. You think? Yes, we definitely looked out of place. So we go into this place and it's in a strip mall and it's called like the vape shop and it has like Creighton. I don't know if I'm pronouncing that Creighton correctly on the door.
Yeah.
It says, you know, Delta 9, Delta 8, and it's a larger store and that's all they do. This is like their thing. So we walk in and we're like, all right, we're gonna go check it out. So we go and we look around and that place was very different. First off, they had a can of Pringles. Now, y'all, I know I'm so naive, but I was like, why in the world is a can of Pringles $17.99 at this store? Anybody know why?
Inflation.
The munchies, that was my first thing. But then they also had a Corona that was like $20 beside it, and it was just sitting there. Anybody know?
Because they're laced with THC.
No, I'm not the only naive one. You can unscrew the bottom of it and you can hide like your drugs in there. And I was like, oh, okay, now we know. So it was like actually a vector, but there was really Pringles in there, but the bottom came off. So anyway, so we're being all very, very scary about that. But the thing that we thought, and Jana, if you want to like, you know, elaborate, the things that we were scared about was the things that look like children's toys.
So, I mean, in this shop, I mean, they had lots of gummies and things like that in the glass case there at the register. But when you're looking at some of the other products for consuming herbs, a lot of them did look like sippy cups or kids' toys or like Mr. Potato Head with like a handle. I'm like, well, that's a little bit worrisome. So we took some real discreet photos.
Remind me of, you know, the big deal about Joe Camel.
Yes.
You know, those,
Yes. Well, these things look like sippy cups and they were literally, I think you packed a bowl of smoke in it. Yeah, like a water bong. And so that was alarming. We talked to the guy there. He didn't own the place. He was doing it for his cousin. His English was not very easy for us to understand, but he was trying to explain the difference between Delta 8 and Delta 9. He was telling one's for pain. So if you have pain, you want these gummies. And if you want to feel good, like I guess high, it was the other ones. And then they had all sorts of different milligrams and things like that. So we left that place and we were like, okay. And of course, we did not buy anything. Like we should say that we did not buy anything. The next place we go to was more of what I would call a dispensary. And this place was right next to a place that looked just like the one we had gone to previously. Or maybe there was one store between them, but it was in a strip mall and you had this place and then you had a store and then the other place. But we went in this one. And this guy was really interesting and said that you had to be 21 to buy anything from his store. He's like, I can't even sell you a cotton ball if you're not 21. And he was talking to us about the edibles, and he too was talking about the difference between pain and recreation. And then he said they have flour. So again, naivety over here. The two of us were like, oh, for baking goods with something. And then he brings out what is actually, it looks like marijuana buds, and he called them flowers. You know, like I was like, at least
Somebody should have followed us around for entertainment.
we're like this, and we're like, oh, this is what's happening. And so he brings out this big jar, and apparently, like, he takes it out and weighs it, and this is the stuff you smoke. And he was very well educated. He knew about the farm bill that Randolph County had talked about that, you know, made it legal to sell these. He talked about where he bought his product from, but then he told us you can't keep it in the car. Because if you keep it in the car, the heat increases the strength. And I said, so what you're telling me is if you take these things that you have here and you smoke them, it's very similar to what people would buy to just smoke illegally on the street. And he said, yes. And he talked about the card that he gave people that showed that it was a farm bill legal purchase of hemp product for smoking. And then we asked him what he would think about marijuana becoming legal for recreational use in North Carolina. And he said he would not like it because it would ruin the business that he had sort of got going there. So all three stops, very different stops. We didn't see a single Skittles or anything like we had been talking about because of what Randolph County said. But the second shop we went to, I would say, was the scariest one. The third one, he said you have to be 21 years of age. And this whole THC letter was really about youth being involved. So that the third one was like, I'm not worried about that. But that second one, if you're a baby and you're in a house, there's a likelihood you're going to grab one of those smoking things and think it's a toy or something you could play with. So
Is there no regulation right now?
no.
You know, I need some, I mean, so no Skittles. Now what's the Pringle can on your desk back there?
They did have quite a variety of different gummy products. He showed us mushroom-based products. But there didn't seem to be any, like, oh, you have to be this age to purchase this. It was very like, oh, yeah, I think you should try this. Kind of.
Sound like that was a good field trip.
It was a good field trip. But what I would say is it sort of changed my thoughts on how we should write a letter if we want to. And again, we've missed this legislative cycle, but looking for y'all's direction if you think that we need to write a letter about these products that by and large are unregulated at these shops. So
Question I have, who was Randolph County letter again? Target, what was the target of their letter? Was it their?
they wanted those sour gummies off the shelf
Okay.
because they thought it looked like kids and it went to the legislators.
Their counties three?
Or however many they have.
Legislature, okay. Well, then I guess, what kind of discussion do we have about this? I mean, I know we didn't have a binding resolution last time, but I think we had a majority of the board members that agreed that it was a good step for us. I don't see any harm in it, and awareness, maybe y'all were getting, but awareness sometimes is good. Maybe we need to go out more and the board can go on these field trips next time.
Yeah.
Same.
A little bit more conspicuous if we all show up.
Yeah.
there, but
That many of us. Okay. So, I guess, discussions about moving forward with a letter, any comments?
Packaging,
The package.
the
What
packaging.
was our action last time? We talked about the letter. We did not write it.
No, we wrote it and
We
it
did.
was distributed via email and then I got some feedback like, yeah, it looks good, we're ready to go. But the issue became that by the time we had it and had it back, we weren't gonna get ahead of legislative priorities. So what we could potentially do is we could, as a board, write a letter, or we could, as the board, ask and just sort of not table it, but hold on to it and get some more fact finding. And when the next legislative cycle comes around, we could ask one of our local representatives, either Watford, Potts, or Jarvis, to come and meet with us. And we could share our concerns about the things that we found. We can include the photos that Jana and I have taken. We could do some more research and just say, we as a Board of Health think that these products are, scary. And I really encourage you all. I mean, I didn't feel scared anywhere we went. I felt a little, out of place because I didn't know what I was doing. And then, when you're doing something sort of under the radar, you feel a little sort of way about it. Jana and I were a little giddy a couple of times, but, that everybody was incredibly nice. But if you go to one of these places, you can really see the things that we're talking about, the wide variety of products that they have. And again, the things that it's one thing if you're a 18, 19, 21-year-old adult making these choices. The scary stuff to us, not to speak for Jana, but we conversated quite a bit about it, was the things that seem to appeal to children.
All this Delta stuff came up pretty recently, I guess in the last few years. Who regulates that? No one?
No.
There's no regulation whatsoever.
I mean, Bull City puts a drink out that's called Flowers. And they market them to restaurants and they sell them in the store. I mean, they're not the only ones. There's many distributors that sell them. They brought me a sample case of them. And I did, I tried them with two guests one night after closing. I'm like, we can't sell these.
Knock you.
You can't sell these because how do you regulate it? You know, like one, and depending, I guess, on your tolerance, maybe, you know, one could put somebody completely over the edge, especially if they've had other alcohol on top of it. Two is a deal breaker, you know. Two, you don't need to be operating a vehicle. So, and I asked Steve Jarvis one night when he was in eating, I said, do you know about these? Because I asked John Clowney that owns Bull City, I said, dude, like, how do you regulate this? You know, like, what are your people, is there a limit? I mean, what? And he said, no. And I'm like, really? So, and Steve said that they are not like nobody's regulating it. Not the ALE, of course, there's no alcohol in them. And not the Department of Agriculture, I mean, nobody.
The only regulation is the purchase of it, right? Being 21.
You know, I don't even know the answer to that, but I'm gonna assume, I mean, there's no alcohol in it, but I guess you have to be 21 to purchase.
Shop.
We can find out about that.
Yeah,
If you're doing it in a restaurant, sorry, and you're actually putting in a drink and an alcoholic beverage, we then regulate it and you can't do it under our food code. But if you're doing it under alcohol, we don't regulate it, ALE does, and so that's kind of where we get into like a little mix where it's not ours. But if you're to put it in food or put it into just a drink that you make, we wouldn't allow you to do it.
You just drink them out, it's a 12-ounce can, like a beer.
Is it alcohol?
No,
Like it's already like made at the manufacturers, like that's what, like at Bull City.
yeah.
Jan and I actually looked for those products, because we were familiar with them and we knew like that they exist. And so like, Crystal's saying, it's just like it looks like a
can.
soda. Yeah, it looks like a Monster energy drink or something, but it's got THC in it.
Have, you know, pretty little flowers on them, you know, that, and that's what it's called, flowers. I mean,
And one thing that I didn't mention that Jana and I learned when we were out there, they have different milligrams for the gummies. And I'm gonna guess that maybe some of the drinks are also different strength.
these are 10, these particular ones are 10. I have seen them where they go to like 40.
Yeah, and so the guy was like, when people buy, the guy at the last shop was like, when people buy my stuff, I tell them, if you've never done this before, you should buy the head off of it or just buy a little bit of the gummy and work your way up, because these things,
yeah,
I guess your experience, you were surprised.
Well, I'm not experienced, but I wanted to, you know, like I wanted to try it before I ordered, you know, several cases of them and put them in our cooler. And I'm like, I'm not comfortable with this. I mean, now we could order them and sell them retail, like take them home and drink them on your patio, because really and truly, that's the only place that you need to consume them. But, I mean, I haven't done it just because I'm like, I don't know. Like, this is weird. They're great.
Law enforcement trip, if you're driving down the road drinking one of
Yes.
those, since there's not alcohol.
That was one of my questions to Steve.
If they did a test on you, the roadside sobriety,
Right.
even if it didn't have alcohol in it and you were inhibiting signs of intoxication, I mean, they're still gonna get you.
Still get you for DUI.
Yeah, I guess that would
Taking
be
any
the only
kind of
thing.
medication, whether it's prescribed or not,
Past
if
that.
you're not
Yes,
safe
yeah.
to drive.
Well, I mean, and if you took a blood test, it's not to say that you had it that day, because it stays in your system for
30 days.
I don't know, like there's a lot of variables there.
so I guess the second part of that is what's our next step? So, no,
I think the major concern of this board was not the consumption of the product. It's mainly the package, how it relates, how a child could come in and say, oh, this is, or not necessarily even be able to buy it, but see it at somebody's house and be like, oh, mom and dad bought Skittles.
Right.
And eat some of the Skittles. I think that was if I remember, that was our concern. So I think if you're gonna write a letter, it just needs to be, you know, around that topic.
in the light of the research.
Right.
The problem though, Christian, is when they went and looked for that product, they
They didn't even find it.
Right.
Yeah, exactly.
Hey,
So is there a need to, even if they're not finding that product?
Gina, did you put those pictures on the H drive? I think we did.
I did, our father's emailed them to you.
Those are nerdy bears. which look like nerds.
Mhm.
Birds, yeah.
Look, if you go on Google and you just type in Skittles with
THC.
yeah, or whatever, like I found plenty of pictures because I went home and
Oh, yeah.
researched the trademark issue. Yeah, there's plenty of stuff out there.
Actually contacted Ferrara, which is the company that makes nerds. They've gone after these companies in several states for patent infringement, so they've won. So they were very interested in seeing that flyer that you passed out the last. And I emailed them a copy of it, but I haven't heard back. I don't expect to.
Yeah, so these
It's a way to
were,
get them off the shelf.
yeah, these were like knockoffs that some company was like, hey, I'm gonna make Skittles. And it was not Mars or whoever. Doing it's what I saw, but I don't like, I don't want to write a letter to a problem that exists, but it's not a major problem, right? And I feel like that there's been good discussion on this, and almost feel like we should table this and come back to it, as we all kind of go home and learn a little bit more about it. Because I'm hearing things like completely unregulated, like I hear that, I have a hard time believing that it's completely unregulated, but maybe it is, right? And to me, I don't think we know enough as a board to address this. And on the issue of the child packaging, Skittles, whatever. I think we're at this point, I'm not convinced that there is a prevalent problem that needs legislative addressing. So
Most of them are just considered like food supplements, like vitamins and such. The FDA has no control over that whatsoever. And they're just passing it along like that.
yeah,
That's all. The supplements. That's it.
Janet, you have something else?
That I thought it might be a good idea for my team to kind of in the interim work on maybe like a public awareness campaign, really just helping people know that, you know, these items are there, they're legal, but also, you know, don't leave it laying around where kids are, just like your Tide Pods and your vapes and all the things that we've seen over the years that appeal to kids, you know, just put that out in the forefront of people's minds too.
I definitely don't think we're ready to submit a letter yet. But, and we obviously don't need a resolution to push this to a next meeting. So does that sound like what most people are okay with? Yeah, so maybe we can incorporate the pictures maybe
Yes,
with with the letter and then kind of review it again if maybe don't mind sending it back out.
I might have it.
And I'll be more than happy to help you write some of it and stuff. And I like to wordsmith things and fluff. Yeah. Okay. Anything else on that? Any questions? It's definitely something to keep in mind because like I said, it's gonna be pretty easy to put a whole bag, you know, I know my boys, when they were little, they could take out a whole thing of Skittles and next thing you know, they're down there for the count, you know, hopefully not out dead, but they're down there for the count for a while and okay, all right, well, sounds good for old business. And now we got some new business and we had a nurses, no, I'm sorry, it was actually a vacation at where? And they happened to have some nurses there at the same time. That was Great Wolf. It was the one in Concord, right?
It was the one.
Okay, all right. Okay. Well, and Daytra's been good to be put on the agenda to give her opinion and some synopsis of it. So please, if you don't mind.
Actually, I think that was the one from last year. That was from 2024.
Oops, I see that now. I'm so sorry.
That's okay. That's fine.
It's the wrong
Mary Lou
location,
and
everything.
Tanya was there and
all of our supervisors were there. So it was an interesting conference. Datra went last year and we were able to go this year and I'm still in your thunder. So if you want to.
No.
That's great.
It really was. And this year, the topic was power review and we had a keynote speaker. She was the CEO of the United Way of Forsyth County. And so she kicked off the morning for us and we had a panel discussion right afterwards with public health nurse champions up in the mountain area. And it was really interesting what they shared. Then we had a nice luncheon time and networking And then the afternoon, we had three breakout sessions. We talked about the 6 pillars of lifestyle medications, or medicines, which I thought was very interesting, especially with patients that are being prescribed some of these diabetes medications and what they really should be doing to help prevent complications by lifestyle management, diet, exercise, stress management, to help decrease the need for some of those meds. There was also a session, and the sessions were set up so you had an opportunity to go to all 3, which was very nice. I know a lot of times you have to pick 1 or 2 and you miss out on some. So we actually had an opportunity to visit all 3 sessions. We had a session that nurses as powerful leaders, and that was quite fun learning about our leadership styles. I'm not going to say any more about that. And then we started our group actually started our time with yoga. So it was all about focusing on wellness for the public health nurses and all the work that they do across the state. So it was a great time. So thank you for that opportunity.
Yes, well, thank you for going.
Yep.
Rather than get continuing education.
Yes,
Very well, that's
we
good.
did get
Okay,
continuing
yeah,
ed, so that was very nice too. But it was really good, and I really enjoyed the panel discussion from the mountain. There's a lot of interesting stories, I would say.
Yes, I would say so, but taken away from that, things learned from Helene, and, you had staff there that their house was gone, but yet they were working a shelter. I mean, it was just so interesting to hear their stories. And really, I learned a lot as far as preparing here for the unknown. I mean, we've set up, it's not typical to have a shelter here, but in my time here at the health department, I have done a few, maybe 6, and but not related to something as bad as what they had to endure. So it really opened up my eyes as far as the unknowns and how to get staff there, because we're getting staff there on ATVs and
Helicopter.
not helicopters, bringing in staff with small planes. I mean, they even had a little place where a small plane was landing. So it was very interesting.
And these nurses were from Henderson, Buncombe, Mitchell, and Yancey counties. And so they all had a little bit of a different perspective and how they worked with, like fire, EMS, to, as Mary Lou said, to set up some of these shelters. And 2 of the stories I remember they shared, one was they had set up a shelter and then they realized that a patient tested positive for COVID because they started running a fever. And she said, so then how do you isolate in a shelter situation? And they worked for anything. And then they had the family that all came in with lacerations, and the father I think had moved up to the highest level of the home, and they broke the window to get them out, and so they all had encountered abrasions and from the class, and so she said, so then we had all of that to worry about.
The minimum need shelter went to a maximum very quickly without them being prepared. So.
And then they also set up an oxygen bar. And she said for those that needed O2, they would have to come in and they would come to the O2 bar and get oxygen and, trying to find tanks and supplies and tubing and everything. It was just, I think that could have been a whole day.
But I will say what I learned, Justin, you'll like to hear this as you were a champion, I tried to be. Most of these shelters are staffed by your local school nurse staff. It's because when these kinds of things happen, the school is out. So you're going to tunnel all of your staff because you still got other things that you've got to do at your, if it's there. But they said 90% of staffing came from their local school health. And I know we have fought that battle and I appreciate that, but, and that's kind of where I go to when I staff our shelters here in our county. Most of the time, if it's an area we have tornadoes, I think down in the Denton area, we did a shelter there at one point. I did use, cause school was out, some of those nurses, cause school was out, instead of pulling nurses from other places. So that was very interesting to hear in black and white that that's who they were using. So.
Deidre, can I ask a question? You brought GLP and like side effects. It's not to throw you under the bus, but what were some of the, even if they're mild, the number one side effects, 2, 3, some of the big side effects of
What, they were not really focusing so much on the side effects as to how you can take better care of yourself to take some of those meds. Right. So the lifestyle management, like your diet, your exercise, as opposed to just, here's a med, take it. That they were really trying, this, her name was Jill Davis, and she was a patient educator with Humana Health. And so what they were really focusing on was how to improve quality of life and not have to take those medications.
Yeah. No medication is perfect.
Right,
Yeah.
exactly.
Any questions for the Daedra and all nurses? Thank you for that.
Yes.
All right, our next item goes to Mary Lou.
Okay, so this is, we have talked about this before, as far as the child fatality, team changing. I think I may have spoke at the last meeting about child fatality or the time before, but as of July 1, the new legislature changes us to one local team. So I forgot I did put something up there. So what it will be considered is, what we have is CCPT, which is led by DSS, and our CFPT, which is led by the health director. So those teams will merge into one team. And we're all planning to do this. It was supposed to be January of this year, and each time it keeps getting pushed out, but we are ready and planning to do that as one team. We had to choose a single county or a multi-county, and it went through to the commissioners, and they also agreed with us that we wanted to be a single county entity. So we're ready. The difference will be, and I think that's on the next slide, is we will not review all the child deaths. This is children 17 years and younger. So previously we did your perinatal, which would be like birth defects and things like that. We were reviewing all child deaths 17 and under in the child fatality program that did not have DSS involvement a year prior to that child's death. So we were getting those. Now in this new system, we will only be doing certain ones. No perinatals unless there was something that we saw in the records that we get that we would want to bring that to full team. No medical conditions, and that means maybe a child had some type of heart condition or something that it was pretty much cut and dry. We would not do that one. And like I said, birth defects. So we will continue to do the suicides, the sudden and unexpected infant deaths. A lot of those types of things are the co-sleeping types of things, the motor vehicle. So that's what we're going to continue to do. Another big change for this will be our reporting, where I did the report to you guys, where I do an annual report. There's no annual report, my knowledge, unless this changes. It's a quarterly report. Because this changed July 1, they're kind of giving us a leeway for this year. So y'all have not gotten this year's quarterly because we really have kind of been half and half. So what I'm going to do in August, I'll probably have y'all the quarterly reports for first and second quarter. But then from that point forward, you're going to get a quarterly report in this meeting here. Also, for if you don't mind with the commissioners, if you will kind of let them know, they're probably used to an annual report. It will be a quarterly report. We do not have to get up and do, like, I won't have to get up and say anything, or it's just going to be a quarterly report of what we've reviewed. If there was any kind of system recommendations and things like that, because we're kind of combining the DSS and the health department types of things together. They're probably going to hear some of it anyway, possibly some of the guys. And I think Karen, Commissioner, let's see, I think they're on the DSS, they'll hear it through their boards as well. But we will probably, you'll just get a quarterly, and I will submit that also when I do the one in August, once I get it prepared and ready, because I don't have everything ready since it's changed over. I'll send it, I'm gonna send it to both. So that's the biggest change. What we used to see, which you guys probably didn't hear much about, we had intensive reviews for DSS. The state would come in, they would bring a panel of people and they would do intensive reviews for children, and I don't know if I put this on the next screen or not, that had involvement 3 years prior to the death. That was not a CFPT, that was a CCPT. Now what's happening is this new combined team, we will be reviewing that as a one local team. And so that's going to be different for us because we're not used to doing those intensive reviews. And then those kinds of things will be submitted. I'm not really sure how, I'm still learning, but that will be the biggest change that you guys might hear about in this meeting would be these intensive reviews for the child deaths. And that would be DSS more involvement. They're going to lead that more so than I would think the health department side, because they're going to have that involvement versus us. So I think that's it unless somebody has any questions. The reporting system will be national. We won't have our regular, nothing that you all need to be bogged down on, that will be a different system. But other than that, it will just be the report to you guys will be quarterly versus an annual type of thing. I think is what you're going to see.
Anything for Mary Lou? Thank you, Mary Lou. All right, next on the agenda, item C there of 8 is we do have to schedule a time for the bylaws meeting, but we and I agreed, or I would not necessarily agree, but I see the rationale for this, and it came from Lillian. So do you mind?
I don't, thank you, Chairman. So as part of continuing education for local health directors, we in Region 3 received some legal training from an individual that used to have the same job that Adam has, but in a different county, but she was really involved with their public health board. And she gave us some guidance on best practices on bylaws and subcommittees and things like that. And her best practices are very different from how we've been operating in Davidson County. Adam and I have had about 30 seconds to talk about this, and he and I sort of kicked it around and realized that we needed to talk some more about how to move forward. Essentially, open meetings law. This board is subject to open meetings law. Don't know if y'all knew that. We don't talk about it a lot. And when we talk about our next item about governance and training, that's something that we need to really go over with y'all. I think everybody knows this, or more people might know this about the Board of Commissioners. If 3 commissioners are together at a meeting and they start talking business, that's a big no-no, because that is a meeting quorum and they are conducting business not as part of the open meetings law for everyone to see. So technically, the same applies for this board, but because there's more of you, the number's actually higher, and I'm not prepared to give you that number. But where we could get in some problems is if we have a subcommittee with 3 people and then 2 of y'all are talking about, oh, the meeting or something like that, then we're technically in violation of open meetings law, which is how the training I received just recommended you don't do subcommittees. If you have some sort of something that comes up, you do an ad hoc, or you just handle everything as the full board. Fine, dandy, wonderful. But we have everything that we do with our subcommittees enumerated in our bylaws. So what we need to do as staff is to get our ducks in a row and bring to y'all a recommendation for changes to the bylaws in the bylaws subcommittee that it currently is now, which as it stands right now is only Dr. Ellington and Mr. Odom. So we're going to need to make some changes to that too. But all that to say, this is when we would normally schedule that meeting, and I'm asking us to pause it to give staff a little bit more time, particularly Adam and I, to get together and figure things out, because it's not gonna be the typical bylaw subcommittee rewrites where we move periods and add commas and change some capitalization. This would be some significant changes, and that committee will need to do it, but then it will come back to the full board to approve it. So that's what my ask is for you all as a board, to just pause on this and give us a bit more time.
And, okay, I think I can ask that question on the next section. So,
I was gonna say, usually I would ask for a day and we'd vote on it. We don't need a vote today. We just needed your permission verbally to just give us a little bit more time to get our feet under us and move forward on this in a way that best serves this Board of Health.
what is our hard time to?
We have to have this done by December 1st.
Okay, so those dates like that, I think confused. Okay, so you know, not a resolution, of course, but any discussion about not doing that, since we have some time, and it sounds like this will be much better for us to stay in compliance with open board meetings. All right, not hearing anything, let's go ahead and do that.
All right.
We'll table that for now as well. All right, and then item number D is the training, and this is where I wanted to dovetail into that, because if we decide on the topic for it of governance, then the board will also have much greater fidelity with it, and it sounds really good. So I guess these were the kind of the. Oh, okay.
I just wanted to refresh everyone. We have to do an annual Board of Health meeting training. We were recommending it for August. My recommendation, based on the need to change the bylaws to get more compliant, is that in August, Adam and I work together with a training for y'all that talks about things like open meetings, subcommittees, bylaws, and things like that. So the whole board hears it. And then when the changes, if y'all are in agreement with making these changes, when the changes to the bylaws are made, we will have heard from any comments or more information that Adam and I are able to give you via the training. And so we have more board input as we consider changes to the bylaws. So my hope was that. I also gave y'all some other options on this screen. You know, we could do HIPAA laws and requirements, North Carolina Medicaid, prepaid health plans. None of these things seem to be really timely, but you know, I don't like telling somebody this is what you have to do, or this is your only option. So that's why I wanted to give you some.
I'll throw my 2 cents in here. I would never want to be an attorney, but I love knowing about the law. So, and when it applies to what I get to do here, I would like to throw out some governance training. I think now who will we gonna try to get the person from Chapel Hill? Oh,
I was thinking that Adam and I would work on this together, and then Adam could present to y'all.
Oh, I knew who you brought up.
Yes, Deborah. Yeah,
yeah.
she gave some really good stuff. Deborah's expensive.
Oh.
And so.
Adam.
The $0 type.
I'm already paid for it.
Okay, all right, that. All right,
So,
Any other
sorry, is that a
discussion?
motion that we do choose governance?
before I do that, is there any other discussion about any other topic? I will make that. Okay, I'll make that a motion that we have governance training as our yearly training requirement. Is there any second? Second, Mr. Kessler. All in favor?
Aye.
And any opposed? We look forward to it.
Right. Just don't get their hopes too high. I will bring some caffeine.
Randolph County will be good, right? That's where I grew up too. If y'all didn't know, I grew up in Randolph County. All right, well, we definitely have a scheduled closed session. So to move into closed session, before the closed session, also, I would like to ask Randy to stay, Lillian, and then of course the attorneys, if can. I need a motion to go into closed session. Motion. And a second. All in favor? We are now in closed session.
Also. Thank everybody.
We are now back in open session. If I could ask Adam to give us a synopsis of our closed session.
Sure, yes. We had a closed session. We discussed one attorney-client privileged issue that involves an active legal matter. We also discussed a personnel matter, and the board provided staff with direction on how they want us to proceed. And that's it.
Thank you. All right, is there any other business that we need to bring up? And our next meeting is on the board there at August 5th. So enjoy another month off with July and July 4th and the holiday. And I'll need a motion and a second for adjournment.
Motion
All
adjourned.
right, Nathan?
Second.
Second, Jason. All right, all in favor?
All right.
Any opposed? All right, we are adjourned.